House Oversight Subcommittee on Children's Child Welfare System will come to order. Will the clerk please take attendance?
Chair Meerman.
Here.
Representatives Regas.
Here.
Paquette.
Here.
Conlon.
Here.
McDonald. Mr. Chair, you do have a quorum.
Representative Regas moves to approve the minutes of the July 22nd meeting. Hearing no objection, they are approved. Today we're hearing testimony on acute onset disorders among children. We will first hear from Bruce Goodman. Bruce, who is going to give an overview of the disorder we are hearing about today. Good. You're ready. I just wanted to say, we have a full committee. We have a full list of people wanting to testify. We have cards. So, we'll just keep it moving in order to give many people the chance to testify. That obviously means there is a real heart to be heard. So, thank you all for coming, and we'll just keep moving and see where we get. We do have a committee coming in at noon, so we really can't go over. Thank you both for coming, and go ahead.
Thank you, Representative Meerman, and members of the committee. Thank you for the opportunity to speak today. My name is Bruce Goodman, and my role today is to provide the background for the testimony that you're about to hear. I'm here not only as a concerned citizen, but as a grandfather. My granddaughter, Una, was stricken with a condition known as PANDAS, at the age of 2.5. Almost overnight, she transformed from a bright, joyful child into someone who was barely recognizable. With treatment, we got her back, but each time the condition flares, we risk losing her again. I'm here to make sure that other children in Michigan can access the same medically necessary treatments that saved Una without delay and without question. Why are we here? We're here to address a disturbing and deeply unjust pattern of medical insurance denials for children diagnosed.
Is the microphone on in front of you? I'm sorry. A red button.
There
Thank
we
you.
go.
Sorry about that.
We are here today to address a disturbing and deeply unjust pattern of medical insurance denials for children diagnosed with PANDAS, a condition that causes brain inflammation and can have sudden, severe, and life-altering effects. Michigan health insurers are not doctors, but they are playing doctor, denying or delaying treatments prescribed by expert pediatric neurologists and physicians. These decisions are made arbitrarily without valid scientific support and to the profound detriment of children and families across the state of Michigan. Today, you will hear directly from families whose children have been devastated by these insurance denials. Some have seen their children robbed of their childhoods. It's experiencing OCD, severe anxiety, personality changes, cognitive regression, eating disorders, and even suicidal ideation. Others will share stories of recovery made possible when insurance companies did approve treatment. The contrast is stark. The consequences are real. Note that what you will hear today will be a brief summary of written testimony that each of the speakers has prepared previously. Some of this was prepared last year, and the speaker may have to update what has occurred since that testimony was written. We sincerely hope that you will each have an opportunity to read the more lengthy testimony, because we have asked each witness to attempt to limit their testimony, their summary, to 3 minutes. So what is PANDAS? Let me provide a brief overview, or you can read tab 1 of the materials before you that we have provided. PANS, Pediatric Acute Onset Neuropsychotic Syndrome, and PANDAS, a subset of PANS, which is triggered by strep, are neuroimmune disorders that cause the immune system to mistakenly attack a child's brain. The result is inflammation that leads to sudden, severe psychiatric symptoms. These conditions have been studied extensively at institutions like Stanford, Harvard, and the National Institute of Health. Experts today are increasingly referring to it as basal ganglia encephalitis. The good news is the condition is treatable. Early intervention with antibiotics and steroids works for most PANDAS cases. 95%, it's estimated, of the cases can be solved with antibiotics and steroids. But for the most severe cases, about 5%, the recommended treatment is IVIG, or intravenous immunoglobulin therapy. It's a treatment made from pooled donor antibodies, immunoglobulins, that is administered intravenously to regulate the immune system. My granddaughter had 4 days of treatment, 6 hours a day of this intravenous treatment. It is used safely for a range of childhood diseases, autoimmune and inflammatory diseases, including encephalitis, immunodeficiencies, and other syndromes. In the PANDAS cases, IVIG is the gold standard treatment for severe or extreme brain inflammation that has not responded to antibodies or steroids. What makes IVIG critical is that it doesn't just suppress symptoms, but it helps reset the child's immune system, stopping the autoimmune attack on the brain and allowing the child's neurological and psychiatric symptoms to subside, often dramatically and quickly. The effectiveness of IVIG in treating PANS and PANDAS has been demonstrated and documented in clinical studies and is endorsed by a national consortium of physicians and researchers. It is a medically accepted, targeted treatment. It's not experimental, not fringe, and certainly not optional when prescribed by a qualified physician for a severe case. See tab 4 in your binder for the step-by-step treatment protocol that calls for IVIG treatments only as a last resort. And yet in Michigan, children are being denied access to this treatment, sometimes altogether, or sometimes after the treatment has run for a few months, and then the insurance company will come along and deny any further treatment. The outcome of these denials is predictable. Children who could have recovered continue to suffer. Despite clear medical guidelines and overwhelming expert consensus, Michigan's private and commercial health insurers routinely deny IVIG treatment for PANDAS patients, even when prescribed by physicians as medically necessary. Sometimes the insurance companies will approve one round and deny the next treatment. Sometimes they revoke prior approvals entirely. These denials are inconsistent, unscientific, traumatizing to families, and life-threatening to children. What you're going to hear are not rare anecdotes. They're part of a systematic failure that has real lasting consequences. The children affected are not getting the treatment they need when they need it. And the longer treatment is delayed, the greater the long-term harm to their brains, not just to the child's mental health, but to their families, their future education, and their future in general. So what's the solution that we're looking for 15 states, including Tennessee and Georgia, just this year, have passed bipartisan legislation mandating insurance coverage for PANS and PANDAS treatment, including IVIG. In Tennessee, the bill passed 97-0 in the House and 33-0 in the Senate. Georgia passed its bill 169-2 and 51-1. There has been bipartisan support for mandate legislation in all 15 states. And for a list of the states that have passed mandates, you can look at the map at tab 2 of your binder. So the question is, why hasn't Michigan passed a mandate? It can't be the cost of such a mandate, because as tab 3 shows, 5 states have done legislative analyses showing that adding PANS and PANDAS coverage would increase insurance premiums by as little as 0.2 of a cent per month in premium costs. And one study shows perhaps 50 cents a month. So we're talking about 3 cents to 6 cents per year in insurance premium increases. I was reading the most recent study this spring where Virginia also passed a mandate statute, and it put the cost at 0.5 cent per month. That's 6 cents a year to save children's brains. Let me be clear, most treatment costs for PANS and PANDAS are already built in to health insurance premiums. The antibiotics and steroids from tab 4 that work in 95% of the cases. It's just the IVIG treatment where the health insurance companies stop following medical necessity prescriptions. When insurers deny treatment, they aren't just delaying care, they're deciding a child's fate. Every denial risks turning a treatable condition into a lifelong disability. We're talking about children, some of whom are suicidal, all of whom are suffering, being denied medically necessary treatments because an insurance company who has never seen, never examined the child, claims that the treatment is not necessary, therefore not covered. Think about that. Would we tolerate this kind of denial for cancer treatment, for diabetes? Why should we accept it when the brain is the affected organ? Now, some will argue against private insurance companies. We've had this discussion with Chairman Meerman. I believe that after today's testimony, everyone on this committee will understand the issue is about child protection. It would be legislative neglect not to act when we have the power to prevent this kind of suffering. What are the costs of inaction? A lost childhood, lifelong psychiatric conditions, parents quitting their jobs to provide care, increased special education costs, mental health system strain, PTSD among parents and siblings. All of that can be prevented if we ensure access is timely and appropriate.
Bruce?
Yes.
Yeah. If you could wrap it up and we'll get to Cindy here. Just try to keep it on track. I'm sorry, Bruce.
I understand,
Yeah.
Representative. We are asking this committee to recommend legislation that mandates full insurance coverage for PANS and PANDAS treatment, including IVIG, when prescribed as medically necessary. Thank you for your time. I invite you to listen to the families and physicians' stories speak louder than mine. One final note, I think I speak for everyone here when I say I'm sorely disappointed the insurance company is not present at this hearing. I know that Blue Cross Blue Shield was invited and has declined. One can only suspect that they cannot offer a defense of their practices. Undoubtedly, they will have their lobbyists in your offices making some type of specious arguments to justify their unconscionable action. Please don't listen to them. Thank you.
Thank you, Bruce. Cindy, go ahead.
Okay.
Thank you. We will
Okay.
take a couple questions if anybody has any after these two, but just in order to keep it moving, we'll, Cindy, and we'll keep going. Thank you, Cindy, for coming. If you could, sorry, condense it down. I
Yes.
appreciate all of you coming. I know this is what you're looking to do, so thank you.
Chair Meerman and members of the subcommittee, thank you so much for holding this hearing and listening to our voices. I'm Cindy Groney of South Lyon, Michigan. On October 17th, 2009, my then 5-year-old son Nicholas woke up sick and was an entirely different child. It was a dramatic overnight change from a happy little boy in kindergarten to a child I could hardly recognize. It would take us an entire year to find a doctor who understood what was wrong with our son. He was diagnosed with PANS in October of 2010 and began treatment for PANS with antibiotics and then steroids. It was determined he needed intravenous immunoglobulin IVIG treatment in late April 2011, and he received IVIG in May of that same year. The treatment was successful and brought back our happy little boy. 18 months later, he contracted pneumonia and the PANS returned. He had another IVIG treatment a few weeks later in November 2012. He has not needed IVIG since. In the intervening years, treating him has been successful using a combination of antibiotics, anti-inflammatories, and steroids. Today, our son is 21 and a senior honors student with 3 majors at Penn State University. There is no doubt in my mind that he would not be where he is in life without the prompt treatment with IVIG that he received. Prompt treatment is critical in obtaining early success by controlling PANS. Delays in treatment are devastating to a child and their family. It takes longer to get control of PANS, and the suffering of the child and family is incalculable. I've been a part of the Michigan PANS group since my son was 6 years old. I've seen the group grow from the 10 original mothers to a group of over 1,000. When my son received his IVIG treatment, other children in Michigan were also able to receive IVIG for PANS without pre-approval. In the intervening years, however, I have watched Blue Cross Blue Shield put up many roadblocks to coverage of IVIG, delaying and then denying coverage decisions, and finally stopping its coverage for PANS, only to start up again with the pattern playing out over and over. Treatment denial costs our public school system. Children with severe PANS need special services from schools like occupational and speech therapy, and sometimes they're placed in special ed classrooms for the effects of continued brain inflammation that results in psychological and neurological issues. Many children cannot stay in school, and it costs families who must take off work frequently or quit their job to take care of their child. I find it especially egregious to deny the children of Michigan the medical care they need, all the while their families are paying health insurance premiums. And because I know firsthand the suffering of these children and the families, the likes of which you cannot begin to fathom. These children and their families do not need to suffer like this because doctors who specialize in treating PANS know IVIG is an effective treatment. We cannot rely on Blue Cross Blue Shield and other health insurance companies to do the right thing for the children of Michigan. In the year it took to get the PANS diagnosis, my 5-year-old son was prescribed an SSRI and Lamictal. Those are psychiatric medications. He was not mentally ill, but the psychiatrist thought he was. He had brain inflammation that would be discovered when he was in the final validation trials for the Cunningham panel, which is a test for brain antibodies. My son had high numbers of anti-brain antibodies. The SSRI has a black box warning about suicide. My 5-year-old, who we did not allow to watch violent cartoons and shows, became suicidal. How does a 5-year-old understand not wanting to live? Psychiatric drugs are not a cure for PANS. They're a Band-Aid that doesn't work to stop the hemorrhaging that is PANS. It's past time to ensure proper treatment by instituting a legislative mandate. It's past time for insurance companies in Michigan to question the medical opinions of Michigan's medical treating doctors and questioning the veracity of the research. Stanford University, the University of Wisconsin, Massachusetts General, Harvard University, The University of Arizona, the University of Arkansas, Dartmouth University, and the University of California, Los Angeles all have established Pandas Pans clinics. Columbia University is a major center of Pandas Pans research. Our neighboring states have mandated insurance coverage. They've done it with bipartisan support. The ball is now in the Michigan legislature's court. Do it for the children of Michigan, please. Thank you.
And you can read Cindy's complete testimony at tab 17.
Thank you. We do have one question from Representative Collin.
Thank you, Mr. Chair. Thank you for your testimony today. I'm just wondering, and maybe we'll hear more from other parents here, but has anyone met with these insurance agencies to figure out why they're denying this coverage? And also, do they say they have studies, or what is their medical background to say this isn't needed after they've already prescribed it and it's obviously been working?
I think that question is probably best left to Dr. Youngs.
Dr. Young, we'll have you up in just 1 second. Okay. You're coming up next with the next. Representative Regas, do you have a question for these two?
I'll save that question for Dr. Youngs.
Okay, perfect. Yeah, Bruce, would it be okay if we switched you out with Dr. Young?
Yep.
Anyway, we can get two up here at a time,
Yep.
kind of talking.
Let Lori get started, we'll
Yeah.
move Dr. Young's up.
Thank you, sir.
Yep.
Thank you.
Lori, go ahead.
Lori Cordoville. My son Nathan is 14. My family is celebrating because Nathan is back in school after 5 years of no education because he was too sick to attend. Honestly, my husband and I thought we would never see this day, but we are here because my son received appropriate medical care that included IVIG. However, we had to literally battle Blue Care Network to get this to happen. Kaiser Family Foundation and many prominent doctors have pointed out that denials only save money if the care is not needed. Denying needed care costs everyone more money because patients just get sicker and require more care when they're properly treated. Our story illustrates this truth and shows how insurance are bad actors in this process. After years of step-up therapy and continuing decline, Nathan was prescribed a course of 6 IVIG. He was improving significantly, going from 20% functionality to 80%. Despite this, BCN denied continuation of IVIG after the 3rd infusion in the series. No one from BCN spoke to his doctor or to us before this decision. Shortly after, Nathan not only relapsed but got worse. This included obsessive thoughts about dying and ending his life, hallucinations, and psychotic breaks where he would literally attack his father and I. Mind you, he is a young teen who is roughly my size, so this was a serious situation. While this was happening, BCN did not allow an appeal to be made for months, contrary to Public Act 60 of 2022. When they finally had a peer-to-peer with Nathan's doctor, their director of medical utilization used this time to belittle the doctor and accuse him of fraud instead of listening to my son's case and the peer-reviewed science. The grievance and appeals process that followed was full of barriers that I do not have time to outline here today, so please refer to my written testimony for more details. In total, there was a 6-month delay in receiving needed care. Today, Nathan is 5 months into PANS remission because he received IVIG per his doctor's prescription as part of a broader treatment plan. He is functioning above 90% now, better than he has in years. BCN should not have been allowed to override the medical plan of the treating doctor when the treatment was demonstrably working. If their goal was to reduce costs, there should have been a discussion of how to do that while maintaining high-quality care. If BCN hadn't denied and interrupted Nathan's treatment, he would have recovered from his worst symptoms a year earlier, and BCN would have saved on cost by paying for 6 IVIG treatments instead of a total of 10. BCN effectively wasted over $100,000 on the first incomplete IVIG series because Nathan regressed significantly after being denied the full series prescribed. Nathan's physical, mental, and emotional health were harmed during the 6-month denial period, and it took longer to see gains in healing during the second full series of IVIG because of the harm done. I implore you to support legislation that would mandate insurance coverage for PANS Pandas kids. A mandate is necessary because playing games with needed care for these kids is robbing them of critical developmental time they cannot recover. Other children deserve the chance to start healing like my son. And I thank you for your time.
Appreciate this. Doctor, thank you so much for coming. I know we had a conversation a month and a half ago, so appreciate your time.
My full testimony is in the packet, but I'm happy to answer any questions you have. This is an abbreviated form. My name is Dr. Susan Youngs. I'm a triple boarded pediatric subspecialist, and I'm the medical director of a large subspecialty center for children with developmental and neurologic disorders, and I've been doing it for a long time, 27 years in at the moment. I am here to urge you to support legislation guaranteeing access to IVIG for children with moderate to severe PANS. It is a devastating form of autoimmune encephalitis that's triggered by simple infections. It can happen to any kid. Strep, COVID, Mycoplasma pneumoniae, and it can take a child's life brain. PANS is not rare. It's 1 in 200 kids. Similar to the rates of diabetes, childhood cancer, and congenital heart defects. Yet the 10 to 15% of these children with severe PANS are being denied proper care, even as medical research overwhelmingly supports the use of IVIG in severe cases. Over the past 13 years, I've treated more than 200 children with PANS. I think I'm one of 5 physicians in the area that has any kind of deep dive experience with these kids, these families. I am in the trenches with them day in and day out. Their symptoms include sudden onset of severe OCD, imagining using 400 butt wipes a day and not being able to get your child out of the bathroom. It includes severe anxiety, separation anxiety, kids can't go to school. Rage, imagine your 5-year-old, your 6-year-old, your 7-year-old screaming at the top of the lungs and destroying your home. It includes loss of academic skills. It includes physical symptoms such as intractable tics, sensory issues, so they're crawling out of their skin, they don't want to have clothes on, they don't want to take a bath, they don't want to get in the shower, and even fecal and urinary incontinence. Imagining your formerly potty-trained child defecating all over your home. Families that I treat describe it like they lost their kid overnight, like a light switch went on and we lost them. About 10% of my patients have required IVIG due to severe symptoms and that didn't respond to antibiotics and anti-inflammatories. IVIG works. Of the children I've treated who in the past were able to get IVIG approved for treatment, all but 2 had dramatic results. One only got 1 infusion and was denied, and the other one had another bad autoimmune disease, and the fact that she didn't regress further was a win. All of them got better, resoundingly better. Our results, my results, were consistent with studies published in respected medical journals, major organizations like the National Institute of Mental Health, leading institutions like Mass General, Stanford, Harvard, all recommend IVIG for PANS. Yet in Michigan, insurance companies are now systematically denying initial requests for IVIG for these severely affected kids. And moreover, formally approved IVIG treatments are now being rejected. Hospitals that once provided IVIG are closing their doors to these patients. And this is not happening in isolation in our state. 15 states, as you've heard already, had to pass legislation to do what was right for kids. And 13 additional states, including ours, are working on legislation right now. Now, in July of 2024, I met with Blue Cross Blue Shield. I sat down with them. They gave me 2 hours of their time. They said it was going to be 45 minutes. It went 2 hours. They asked me all kinds of questions. They were respectful. I knew they would be because I knew the person I was talking to personally. But at the end of it, I said, let's get together. Let's look at all the literature. Let's go through the IVIG studies together and let's do right. Let's do better for children. They said, we'll just leave it open-ended. And I never heard back from them. And after that, IVIG denials went up, not down. In addition, Blue Cross Blue Shield and other insurance companies, they're applying a set of standards that are meant for a different form of autoimmune encephalitis instead of for PANS, and they're ignoring completely the clinical and research-based guidelines specific to PANS. So, children's futures are at stake. Their brains are literally on fire. I had a little girl in my office walk over to me. She grabbed my hand, put it on her head, and said, fire. Just breathe that in. I've seen firsthand how IVIG can give kids back their lives. Michigan must entrust doctors, not insurance companies, to decide the care for vulnerable PANS patients. I respectfully ask for your support in passing this legislation to guarantee access to IVIG for our kids with moderate to severe PANS. These children deserve the ability to have their brains heal. Thank you.
Thank you, Doctor. If you could stay put, and Elizabeth Paddock, if you wanted to come up right now as well. So, Doctor, we have a couple of questions. I think I'm just going to turn it back over to Rep. Collin to ask your question again.
Well, you have answered it. Obviously, you met with Blue Cross Blue Shield, and also it sounds like other insurance companies are doing the same thing. So, yes, thank you for answering that, and I'm sorry that this experience happened for you after spending 2 hours explaining the issue around this.
And Representative Regas.
Thank you, Mr. Chair. I just have a few, I was jotting some notes down during your testimony. Thank you very much for that testimony. It was very informative. I do have a few short questions for you. Is IVIG FDA approved for PANS?
It's FDA approved. It's been used in kids with autoimmune disorders for forever, literally forever, and it is approved for the form of autoimmune encephalitis that's more classic autoimmune encephalitis. It's not approved, I think is the better thing. People are using it all over the country. There is study after study after study, research study after research study. Hundreds of thousands, not hundreds of thousands, but thousands and thousands of children have received IVIG. Mm-hmm. We're not getting pushback on it at all.
Sure, but so
FDA is not saying kids can't use it.
But it's not actually FDA approved for PANS.
It's FDA approved as a treatment for all forms of autoimmune encephalitis.
Okay.
May I add to the answer as well is Stanford and UCLA just completed the Octagon study, which is a treatment-controlled, double-blind trial of IVIG versus a placebo. They are in pre-publication, but they report that results for moderate to severe PANS are positive with IVIG. This will be the gold standard going forward.
Is the FDA approved that though?
I think the FDA, it's interesting, right? The FDA approves a drug for care, and then it gets used in a lot of different circumstances over the course of a lifetime. So it's a tricky question to ask because I don't know that, I don't ask the FDA if I can use antibiotics. If the literature, if the global literature suggests that this treatment is effective for children, then people use it.
If it's, I guess I'm not understanding why the FDA just wouldn't approve it specifically for PANS.
Doctor, maybe I could ask the question this way.
Sure.
In the medical field, do you have any idea what percent treatments are used off-label generally?
I don't know a percentage, but a ton. I mean,
Yeah,
every day, all day long.
And that's doctor-suggested off-label treatment happens. My point is, I think it happens often.
Yeah, it does happen often. What I was going to say too is, so for example, I recently attended the Inflammatory Brain Disorders Conference, which is the leading renowned experts on this topic all over the United States and all over the world. And when they were presenting cases, they didn't present, does IVIG work? Or is it FDA approved? They just presented cases and it rolled right off their lips that, and then the kid got IVIG, and then the kid symptoms got this much percentage better. And these were very nuanced level 505 cases of kids with pandas and pans. So I don't think the people that are actually treating these kids are debating at all
Sure.
whether it's effective.
What other treatments for PANS are FDA approved?
The treatment protocols for pandas and pans, okay, include antibiotics.
Okay.
They include nonsteroidal anti-inflammatories, which are things like Motrin, naproxen, aspirin. They include steroids, similar to prednisolone, prednisone, and then immunomodulatory things like IVIG. Some people are using plasmapheresis. Other physicians are using some immune modulating medications that are getting some traction, like rituximab. There are, and so all of those are being piloted in ongoing studies. The number of IVIG studies that have been done since 2017 is about 9 studies. Almost every year a new IVIG study is published. The data on IVIG, as you look at that collective evidence over the last 8 years, is undeniable. It's like 85 to 95% improvement in the kids that receive IVIG in every single trial.
What is the cost of IVIG?
It's about 10 grand a pop.
Okay. So have conversations been had with pharma about the cost? Because I had read that the treatment is actually not $10,000. So I'm curious to why there's a discrepancy there. Why are parents being charged $10,000 for this treatment if the treatment is not actually $10,000?
Well, the parents who are being denied access have to pay cash. And so they unfortunately have to go to physicians who can get the medication and give it to their child, and they're at the mercy of whatever the physician is charging them for the IVIG, which is why insurance mandates are also important, because only certain numbers of kids can actually access that at cash.
Okay. Are there any carriers in Michigan that cover IVIG? I mean, you've specifically named Blue Cross Blue Shield several times, but are there any other carriers that cover IVIG?
Well, I think all the carriers cover IVIG. The question is whether they cover it for PANS.
Okay.
Okay.
So do any,
So
okay, let me reword that question then.
There's hundreds of disorders that require IVIG infusions to treat. The real question is the denials on PANS kids.
Sure. Are there any, okay, I'll reword that then. Are there any insurance carriers in Michigan that cover IVIG for PANS?
I have had a handful of kids get Medicaid approval for IVIG. I've had one, I think, United Healthcare patient.
Thank you.
Okay, thanks.
Representative McDonald.
Thank you, Chair. Doctor, my question is just if I'm using a medication for off-label use, does that mean my insurance company won't cover it?
No.
Right, no.
Lots of insurance companies cover off-label use of medications every day, all day long. Really needs to be decided by physicians who have the experience to make that call, not insurance companies.
Thank you. Elizabeth, if you want to start, and KT, if you come up on deck.
Is it all right if my son joins me?
Yes, that is fine.
Yeah, come on up. I'm going to take a risk here today and take my mask off, which is not something we usually do, but it's really important that you hear me. My name is Elizabeth Paddock. My husband Jonathan and I are lifelong residents of Dearborn, Michigan, and we have 2 sons who are here with me today. Our youngest son, Caleb, became seriously ill in November of 2022. He was diagnosed with Mycoplasma pneumoniae, a bacterial infection affecting his upper respiratory tract. Very shortly after, he exhibited a drastic, terrifying shift in behavior, mood, and cognitive functioning. Caleb developed severe obsessions, uncontrollable vocal tics, mood swings, and terrifying violent outbursts. His ability to perform basic mathematical tasks like adding or subtracting simply vanished, and he was unable to attend school for 7 months. This for a child who had previously been working 3 full grade levels ahead in all subjects. The obsessions and compulsions were severely disabling, and the loss of cognitive abilities was incredibly alarming. In December of 2022, Caleb was diagnosed with post-infectious autoimmune encephalitis, also known as PANS. The Mycoplasma pneumoniae infection triggered his body into attacking his brain. His doctors prescribed a treatment plan that included antibiotics for the infection and anti-inflammatory and steroid medications to reduce the swelling and inflammation in Caleb's brain. The doctor then determined that it was medically necessary to start high-dose IVIG, which is used to reset the immune system in PANS patients. This treatment is fully supported by decades of research from leading institutions such as Harvard, Stanford, Yale, Columbia, and the National Institutes of Health. However, when Caleb's neurologist ordered the IVIG, Blue Cross Blue Shield denied coverage for the hospitalization required to administer it. This is a very specific loophole in the state of Michigan with our IVIG providers that Blue Cross Blue Shield takes advantage of. The health system we use, Henry Ford Health System and Dr. Constantino, does not have a pediatric outpatient infusion center, so the treatment had to be administered in a pediatric inpatient unit. Additionally, the inpatient setting was required for Caleb's safety, given his pre-existing condition of mast cell activation syndrome, which puts him at incredibly high risk for severe allergic reactions up to and including anaphylactic shock, which is a risk associated with high-dose IVIG. Despite providing our insurance company with multiple letters from Caleb's many doctors explaining the necessity of inpatient treatment for his safety, Blue Cross Blue Shield continued to deny coverage. They based their decision on a review by an emergency medicine doctor who had never examined Caleb, never met Caleb, couldn't pick my son out of a lineup, and who had no board certifications in neurology, immunology, or pediatrics. Please let that sink in. After multiple attempts, including a peer-to-peer review with Blue Cross, they continued to deny coverage. I spent over 30 hours in 1 week on the phone with our insurance companies and Caleb's doctors, almost a full-time job, while I was caring for Caleb, who at that time required full-time supervision for his safety. He had to be this close to me, and I spent 30 hours communicating with Blue Cross Blue Shield, our insurance, and his doctors. Finally, after extensive effort, our Mesa insurance overrode Blue Cross's denial for Caleb's first round of IVIG. He was admitted to the hospital for a 5-day stay where he was closely monitored. His vital signs were required to be taken by a nurse every 15 minutes for the delivery during the duration of his IVIG, which took 6 to 8 hours for each of the 5 days. Fortunately, he tolerated the treatment without complications. Per protocol, his neurologist then ordered another round of IVIG the following month to be administered over a 2-day hospital stay. However, Blue Cross denied this next round of treatment, claiming that because Caleb didn't react to the first dose, he was no longer at risk for allergic reactions. This total and complete disregard for Caleb's extensive and well-documented medical history was deeply alarming. They were putting his life at risk. Another 15 hours of phone calls, Mesa again stepped in to override Blue Cross's denial. Eventually, Caleb received 4 rounds of IVIG over 5 months, each requiring an extensive fight that we did not have the energy or resources for. And his IVIG treatment ultimately led to significant improvement in his condition, and Caleb will share a little bit about what that looks like in a moment. The trauma from Caleb's illness and the subsequent insurance battles have left our family with lasting emotional scars, including a diagnosis of PTSD for me. Our family continues to live in constant fear of a reoccurrence, as PANS can flare with any new viral illness or bacterial infections. We take precautions daily, such as wearing masks indoors, to prevent triggering another episode. Caleb is thriving, and we will do anything to make sure that continues. It is unconscionable that health insurance companies like Blue Cross Blue Shield prioritize profits over the well-being of children and families. In 2023, Blue Cross's CEO, Daniel Lope, earned over $15 million, including a bonus that was worth 600% of his salary, while my family paid over 20% of our annual income for health insurance that repeatedly denied life-saving care for our son. I urge lawmakers to require insurance companies to cover all treatments for pediatric acute onset neuropsychiatric syndrome, including IVIG, in whatever setting is recommended by their prescribing doctor. Insurance companies should not practice medicine. Let me repeat that. Insurance companies should not practice medicine. They should not force families to choose between keeping a roof over our house or keeping our children alive. We pay insanely high premiums for health insurance. We pay over $20,000 a year to carry the best care possible for our family. And our kids deserve proper access to medical treatment as prescribed by their doctors. The doctors who know them, who evaluate them, who care for them, who see them regularly. Please protect our children, and please hold insurance companies accountable for covering medically necessary treatments for PANS and PANDAS.
Thank you.
Caleb, would you like to introduce yourself?
Hi, my name is Caleb Paddock. I just wanted to say thank you for taking the time to learn about PANS and PANDAS and for helping kids like me. I was diagnosed with PANS at 13 years old, and IVIG saved my life. When I was sick, I was completely unable to function. My OCD was debilitating, and I was completely unable to attend school for 7 months, like at all. And I received 4 rounds of IVIG that my parents had to fight extremely hard for. So I'm thankful that they fought so hard because I'm able to be here today because of them. I still have to fight residual OCD daily, but I'm back in school and I'm taking physics and algebra courses at Henry Ford Community College this semester. I would not be here without IVIG, but my parents should not have to fight as hard as they did to get people like me proper treatment. Please let our doctors dictate our care so that we can return to being healthy and successful kids. Thank you.
Mr. Chairman, I would just note that Representative DeBoyer was hopeful that he could testify today because his daughter contracted PANDAS or PANS. And I'm sorry that he's not here, but I would encourage members of the committee to talk to him. Luckily, he did not need IVIG. She was taken care of with antibiotics.
It's still possible he'll show up. Yes, Kim, if you want to take it, and Michelle, if you want to come up on deck. Stackpool.
Good afternoon, Chair and members of the committee. Representative McDonald, we met earlier this year in Troy. My name is Kim, and I am a mother urging your support today. Caleb's story is really tough for me to listen to because that's a story of hope. Our story is a story of what happens when things continue to go wrong. To see that boy talk proficiently and recovered is a celebration, but also a stab in my heart. Our story captures a devastating cost of misdiagnosis and delayed treatment of PANS. In 2022, after several immune challenges, our healthy, thriving 11-year-old boy in the top 2% of the country developed PANS. Many specialists missed the diagnosis. Instead, they labeled him with ADHD, pseudo-seizures, Tourette's, and even spontaneous late-onset autism at the age of 11. Critical time had been lost, In months, my son would begin to seize without treatment. Frustrated and scared, we took him to the hospital. His history was completely ignored, and dozens of medications, procedures, extensive exposures to anesthesia, and a single IVIG infusion were given. But they were given without PAN's expertise and led to full body rashes, severe inflammation, and the onset of relentless seizures. Weeks later, he spent his 12-year-old birthday in a medically induced coma on life support. How did we get there? Insisting on idiopathic epilepsy, but confounded by his symptoms, the neurology team abruptly ended their investigation while he was in the coma, stating, "I'm sorry, there's nothing more we can do for your son." Through a loophole, we were able to gain transfer to a second hospital. Here, the team addressed his post-coma complications, needing treatments for his lungs and requiring 2 renal surgeries. The coma was never necessary. Unlike the first hospital, they did suspect encephalitis, but denied our request for additional IVIG and infectious testing, citing both CDC guidelines and insurance limits. Instead, they prescribed immune-depleting monotherapies without protective IVIG. Within weeks, our once brilliant boy had lost all executive function, unable to toilet himself or dress. At one point, they did not believe me that he had been normal, and I had to offer character witnesses. Without proper training, physicians failed to recognize PANS, and they overlooked an infection-driven illness. This exacerbated his growing encephalopathy. Had physicians been trained to recognize and treat PANS with IVIG, our nightmare could have ended there after 2 months of hospitalization, but it goes on. In all, we sought care from 4 Michigan and 2 Midwest hospitals. Each time, IVIG and further infectious testing were denied due to insurance or lack of expertise. Instead, there were more immune-depleting drugs, and when those didn't work, they ultimately recommended brain surgery. After many months in the hospital, our 12-year-old son, there he is, endured a stereo SEEG with the 18 electrodes drilled into his skull, into his brain. The surgery was performed while he was totally and utterly defenseless and immune depleted. It was said to be both painless and safe, but it was anything but. It left permanent scarring all over his head and no new diagnostic clarity. Our son was in agony, and as recorded on video monitoring, was begging to die. Why was safe and effective IVIG denied while doctors gambled on risky immune depletion and brain surgery? We will never understand. Devastated, we faced 2 options: consent to the next frightening proposal, partial removal of his skull and implantation of a palliative seizure device on his brain, or continue trusting our instincts and pursuing IVIG and etiology. Not being heard by these institutions, we made the costly decision to seek private care. These renowned PANS specialists, who we still pay for today out of pocket, used readily available advanced testing to reveal urgent metabolic needs, neuroinflammation with the Cunningham panel, also known as the neuroimmune panel, the CDC positive, and they also found CDC positive Lyme and Bartonella actively attacking our son. All of it continues to be paid out of pocket, and for the first time, our son was finally prescribed what should have been offered in the beginning: antibiotics and IVIG. Returning to Michigan, we faced another uphill battle from local providers and insurance. Clinicians repeated the familiar: insurance won't cover it, we're not trained to treat it. Indeed, securing IVIG required a tremendous burden of proof, appeals, and peer-to-peer reviews. Finally, in March 2024, 2 years after onset, our son received those antibiotics and IVIG. The results were striking. Within 3 IVIG infusions and antibiotics, his daytime seizures, which once numbered 65 a day, that's every 15 minutes around the clock for months, they improved by 90%. And all of his psychiatric and neurologic symptoms improved. We celebrated, but we also wept because treatment came too late for our boy. Misguided immune depletion without protective adjunct IVIG delivery has now rendered our son chronically immune deficient. Along with other late-stage sequelae, brain damage, epilepsy, lifelong disability, he now requires 24-hour care and a one-on-one aide for his partial school days. He also has 2 aides through Oakland County that work in our home. A child whose college we had saved for that he will likely never use. The heartbreaking truth is that with timely, simple, affordable therapies in the beginning, like antibiotics, anti-inflammatories, and IVIG, his disease progression could have been prevented. Instead, our lives have been ruined with unconscionable suffering. $2 million in largely ineffective care. 6 figures and compounding today out of pocket for specialists and continued therapies. What might have cost an initial $100,000 in initial treatment is now a lifetime of infinite debt for our family, our insurer, and the state of Michigan, who now bears the brunt of his care. That's just our case. I shudder to think of what an actuarial review of this would show. Consider the hundreds of children each year who are similarly misdiagnosed and left without appropriate treatment, leading to severe medical, mental, and economic consequences. Committee members, this isn't just a failure. You've heard it before. It's a tragedy. Families hear the same words. Insurance won't cover it. We don't treat that here. And while the cause of PANS may be debated, the treatment is not. These physicians hesitate not due to lack of science. PANS is recognized by the American Academy of Pediatrics. They hesitate because of policy and because coverage lags. For now, Michigan is sitting on a public health crisis. Your action will ensure that no child suffers as ours did, that no family faces the financial ruin for life-saving care that our family has suffered. And Michigan avoids the staggering cost of a preventable disability. Please choose action and support this legislation. Thank you.
Thank you, Kim. We'll now hear from Michelle and Terry if you want to get on deck. Thank you.
Good morning. My name is Michelle Stackpool, and I'm a public school educator from Grosse Pointe Park, Michigan. My husband and I are both educators, and we adopted our son, Jack, after struggling for over 10 years to grow our family. Jack is the light of our lives. In January of 2021, Jack contracted COVID. While his case was mild, what followed was nothing short of a nightmare. Over the weeks that followed, Jack began picking at his hands and feet until they bled. He developed tics, smeared feces, and suffered from debilitating anxiety and OCD. We watched our happy, vibrant child spiral into someone unrecognizable. Desperate for help, we found a pediatric neurologist who diagnosed Jack with PANS, a condition he developed after his COVID infection. The doctor recommended IVIG infusions, a treatment that proved to be a miracle. Jack's tics stopped, his anxiety lessened, and he started engaging with the world again. He was the child that we knew and loved. But then, after 8 months of successful treatment, Blue Cross abruptly stopped covering the IVIG treatments. We fought, appealing, fighting for the care our son needed, but we got nowhere. Blue Cross insisted on invasive, unnecessary tests, including a lumbar puncture, which caused Jack to experience severe spinal fluid leakage, resulting in weeks of vomiting and headaches. It took another round of anesthesia to correct this. Fast forward to today, and Jack is now hospitalized in an inpatient facility. His health has regressed without his IVIG treatments, and medications have not worked. The beginning of the school year was too much for him without his necessary treatment. Our son, who is 9, is now in a facility for the next few weeks, and we are unable to care for him ourselves. The pain of dropping him off, not knowing when we will see him again, is indescribable. That moment was last year on my birthday, September 11th, not the best day to begin with, 2024, the worst birthday I could ever imagine. After many battles, Blue Cross finally agreed to cover 2 more months of IVIG treatments when Jack is released from the hospital. But we know we'll have to fight again. And the uncertainty about his return to school and his future looms large. We are not sure when Jack will be well enough to return to school, and he may have to repeat 4th grade. This didn't have to happen. If IVIG were mandated at the state level, Jack would have received the treatment he desperately needed long ago. He would be home with us, enjoying life and not missing birthdays or school. He wouldn't be calling us daily, asking when he could come home. I urge you to consider passing this bill and helping families like ours. My husband and I have dedicated our lives to helping children, and we promise to give our boys the best life we could, but we cannot do it alone. I will also tell you that we did get his IVIG infusions reinstated, and he swam on a swim team this summer, participated in a summer theater camp, is starting middle school on Tuesday, running on a cross-country team. He still has his struggles, but the IVIG has saved our child. Thank you.
Thank you. Just want to point.
Do you need me to move over?
No, you're
Okay.
fine. You just move it. I just want to point out to my colleagues up here, just keep looking at the faces in the gallery there, and they tell the story as well. Thank you. And yes, if you'd like to continue, and Terry, if you want to come up.
I'm Terry.
Oh. Christina, do we have Christina here? Jess Secord, do you want to come up? There are more, but I'm just sort of taking Christina's place. But go ahead, Terry, I'm sorry.
Hi. My name is Terry Cook. I live in Memphis, Michigan. I am here asking for your support to help get consistent and reliable treatment, medical treatment for our children with pandas, for which my son Charlie has. Charlie joined our family via adoption from the foster care system at the age of 5. From the start, we were trying to manage many, many difficult behaviors, a lot of adjustment issues, of course, but a lot of the behaviors weren't responding to any psychiatric treatments. Like some of the parents here, we went from doctor to doctor to doctor to try to figure out what was going on. Of course, they did extensive testing, and he was finally diagnosed with pandas because he had an untreated strep infection as a younger child prior to us having him. That was at age 7. When he would go through a pandas flare, usually along with an illness, and it was spring or fall with allergies, his symptoms weren't like every other child where they would have a fever or whatever. He would misbehave. He was aggressive, his cognitive decline, drooling, a lot of physical symptoms that, I mean, he still to this day doesn't run a fever when he's sick. He was suspended multiple times from school, and that's so hard on a working parents, I should say. So we, like everybody here, have struggled. He was treated with antibiotic steroids and psychiatric meds for years, but it wasn't until he began IVIG infusions at age 14 that we really saw significant improvement. In his high school, his academics improved significantly. He could manage some money. He could do, because he does have a cognitive impairment on top of it, so these are big skills. He joined the football team. He was able to do a work-based learning program at school, and he was thriving, both school, community, doing fantastic. But in late 2023, his IVIG treatments were denied, and we continued to fight and appeal like everybody else in this room. And the consequences were awful. He could no longer do math. He was having bowel and bladder accidents at school. He couldn't make a sandwich. He couldn't take a shower. He had no idea which bottle was shampoo, which bottle was conditioner, or any body soap. It was unbelievable how unable he was to do just his daily care. He was aggressive, both to me and my daughter, and he's 6 foot, 200 pounds. It wreaked havoc on our entire family. My husband was staying away from the house because he couldn't handle it, which left me in a chaotic and unsafe house. Anyway, I mean, I'm a social worker by trade. I'm a mom. I fight for my kids. And that year about broke me. I did not know if I was going to make it myself without wanting to run away. We were approved for IVIG, and we started again in January of 2025. And that was about a 3-month process of appeals, peer-to-peer, and all kinds of fighting. Thank you to Solio Health, who helped us with that. Within a week, his work-based learning instructor was amazed at the improvement. He knew how to plug in a vacuum, which he had always done before. He was able to get to his job and complete the tasks without any supervision, which prior to that, he couldn't even find where he was supposed to go in the school. They would find him wandering. So within a week, we saw significant improvement. His success at school, his grades that year went from D's in the fall to A's in the spring. We're back to sports. He's been successful at school. He's working part-time at our family shop. And we finally feel like we have a future for him again, because we were there. And we said, you know what? He can be a successful part in the community. He could live on his own. He can manage. And last year, without that treatment, not a chance. And so IVIG has given us hope. Am I afraid come December 2025 when the treatments are no longer approved? Yep, because I don't know if they'll approve them again. So that's why it's important for everybody to have those treatments when they're ordered by a doctor. So I appreciate your time today. Please help us get the care we need for our kids, because we battle so many things every day. This is one we shouldn't have to battle. So, thank you very much.
I have a couple questions. Is that all right if we ask them?
Yeah,
Okay.
yeah.
Representative McDonald.
Actually, I wonder if I could ask a question of the doctor again.
That's fine.
Okay. My question is, I think it's confusing for those of us who don't have this experience to try to understand how many treatments are required, and how can you tell that the treatments have, like, is there an end date? Or are there, you've talked about flares as well, but how long does it usually take? And do you have cases where people who were pediatric patients no longer need any infusions?
Yeah, that's a complicated question. So a lot of the studies on IVIG are serial infusions, monthly infusions. Sometimes 2 infusions, sometimes up to 7 infusions, and sometimes monthly infusions for quite a while. Can be a year or 2 in the making. So it depends on a child's response, and it also depends on a child's ability to come off of it without regression. And in each child's case, it's varied. So I've had patients who've only needed a couple infusions, and they do fine, and they're able to come off, and then they're able to be managed with anti-inflammatories and/or antibiotics. And then I've had children who have needed several years of serial IVIG with then spreading out the IVIG infusions and then over time able to come off. So it varies, and I think the research is still is evolving on that topic. So I would say it's also higher dose IVIG. So most studies are looking at 2 grams per kilogram per infusion, which is a little high. The autoimmune encephalitis dosing for IVIG as well. So a flare, to your question, is with treatments, we can, whether that's antibiotics, anti-inflammatories, steroids, whatever it is, we can get a child sometimes back to their baseline, sometimes partially back to their baseline. And then we're doing this dance, living life with some residual symptoms on a minute-to-minute, day-to-day basis. And then when a child bumps into another pathogen in the community, whether it's strep or COVID or influenza or whatever it is, they will go through what we call a flare. And their symptoms will get dramatically exaggerated. And for each child, that symptom complex, it varies. And the severity varies. So the IVIG piece, right, is for the kids who really have criteria that fall into the moderate to severe range. The rest of it, I mean, I can tell you, I've managed over 200 kids in the last 13 years. And we're in constant communication. We call back to school is germ season. I'm going to have a lot of kids in flares. Most of them don't need IVIG. But 10 to 15% of them do. And those are the stories you're hearing today. And without IVIG, these kids' brains are devastated. And I can't get them back to where they go. So,
do you know how many American kids, do you have a number, like how many are that serious that they need IVIG?
Well, I mean, 1 in 200 children are affected with IVIG, and it's about 10% of those. So if you do the math on how many millions of children there are, I did the math on Michigan, and it was about 1,500 kids.
Okay. I just want to point out, if I can just make a statement.
That's just my health system. 1,500 kids just in the health system that I'm part of, that it could.
That's fine.
I just want to say to just help understand, I have rheumatoid arthritis, and I've been taking Enbrel for 35 years, and it's cost the insurance company between $6,000 and $10,000 every month of that 32 years, 37 years, whatever it is. And there are 1.5 million adults and children also take Enbrel. So somehow they're affording that, and they're not going broke. The insurance companies are not going broke.
Can I offer like an example of what you were saying with my son? We had gone through his initial rounds of IVIG for like 6 months, back to back, every month. We did the first 5 days. And then after that, he was doing so well, I would only request it from the doctor every 2 to 3 months because we could see little symptoms. Drooling, his handwriting would get really bad, and his focus would get off. We would get an IVIG treatment. We were back to normal. It was approved. A couple weeks, everything was back to normal. Once he went off is when we saw these extreme flares. And right now, he's back on getting them every month until we can get him stabilized again. But I was using it sparingly because it is expensive, and he didn't need it, so why give it to him? But when he needed it, because you see, it just was, the last year was unbelievable.
And again, I think that's why it has to be doctor-directed. You have to be working with physicians who are in the trenches with these families on a day-in, day-out basis, and the severities of the presentations. There's a really great review article from 2018 where they looked at 600 kids and the symptom profiles in there. I've seen children with every single symptom that they've listed in that. There's like 40 symptoms listed, but each kid's presentation is variable, and the severity varies for sure.
And I can say in our case that we actually didn't use use all of the IVIG that we were allotted because my son went into remission and it wasn't necessary.
Representative Regas.
Thank you, Mr. Chair. And I'm glad you're back at the table, Dr. Youngs, because I've had some time to think and you know, hearing the other testimonies from the other parents and how devastating this truly is. And I'm, as a parent myself, I couldn't imagine if my child had gotten an illness and it wasn't covered by insurance. But to me, sitting up here, the most important question to me is not why are the insurance companies not covering this? To me, the most important question is why are they charging so much for this medication when the cost of the actual medication is $10 to $15? Why is there such a discrepancy? Who is profiting from that discrepancy? And how can we rein in big pharma? Not the insurance company, but how can we rein in big pharma? Because they mark up medications up to 1,000%. And it's not just for this treatment, it's for cancer treatments and all of these other treatments, like you were saying, Rep. McDonald, about your treatment and how expensive that is. Why are we not addressing big pharma? That is why so that's my question to you. Have you talked to the pharmaceutical companies about the cost of this medication?
Me personally, no. Because taking care of kids consumes my entire life.
But you question the insurance company for not covering this. I would go above that and go to big pharma.
I hear you. Right now, our fight is trying to get the treatment into kids' hands.
Sure.
I think everybody in this room would love.
Sure, but to the parents that can't get it covered, why are they living in a dire financial situation to get their kid healthy? Because that's what you do when you're a parent. You do what you have to do to get your child healthy. And if that means paying $10,000, selling your home, doing all of these things to creatively come up with this money, why would you have to come up with such a high amount of money anyway when the treatment does not cost that much? That is a racket. I would encourage you.
I don't disagree with you.
I would encourage you to look there.
Hang on.
That's not our job
hang on.
as parents.
Just hang on. We're gonna keep on testimony. I do see someone with a hand raised. If you'd like to give a comment, that's fine.
I would like to comment on that if I can. It's absolutely appropriate to take on big pharma, but it is incredibly true, and we found this out for ourselves. Insurance companies charge, hospitals charge, insurance companies different prices when people have insurance versus when they don't. We actually looked at not carrying health insurance and running the risk of any other illness, injury without insurance, because we did price comparisons. Hospitals will charge a much smaller amount for anything from a regular blood test to something like IVIG, CT scans. An MRI, if you don't have insurance, will run you about $600 to $800. If you have insurance, they must charge you the insurance prices, and that can be anywhere from $5,000 to $12,000. So while big pharma does need to be held accountable, these insurance companies have different price points. The hospitals have different price points if you carry insurance. For us, the risk of letting 2 teenage boys run around without healthcare insurance could have been devastating for our family. We could have accessed IVIG out of pocket much more affordably if we didn't have insurance. But if you're a parent, you understand that's not a risk you can take. So it is significantly the responsibility of hospitals and insurance companies. They are making massive profits.
I understand your frustration, but my question was solely about the cost of this medication.
Okay,
And
Significantly different if you do not carry insurance.
all right.
thank you.
We've covered that well enough. So to my fellow committee members up here, we are gonna go over. We can have this room longer, so we're gonna go to 12:10 as of right now. If you have to leave for a meeting, please go ahead. Feel free to do so.
Can I make one additional comment on cost?
And then we're going to move over to Jess for committee, and we'll have a testimony. We'll have some others coming up as well.
It's
Yes,
been
thank you,
said
Doctor.
before, but I don't think I can understate this. In the children who are being denied access to IVIG, the incurred costs to society are huge. The kids are put on homebound school. Kids require outpatient therapies, PT, OT, speech. They require outpatient psychotherapy. They often end up hospitalized in inpatient psychiatric wards. They undergo unnecessary diagnostic testing that include MRIs, EEGs, cerebrospinal fluid studies. I have a child who was misdiagnosed at one of our best institutions who just had literally $1 million workup, and they missed the diagnosis of PANS. And so the cost of not doing IVIG is the question we have to be asking ourselves, and it's astronomical for the kids who actually really need it, because they're the severe kids who then are going to spend a lot of money in a lot of different ways and are going to end up potentially needing community mental health, Social Security, Michigan Rehabilitation Services interventions, all of those things, when instead we could have treated them and restored them back to their typical selves.
Thank you. Thank you, Doctor.
Just really quick, Dr. Youngs, what would the alternative be? Like, a doctor can't just go through this without insurance. You can't just go on like the black market and go administer IVIG without going through a whole bunch of processes, correct? So,
Well, I'm part of a health institution, so I know I can't do that.
yeah.
I guess private practices may have the ability to do that, but.
We could go to Chicago and get it done.
Well, that's what I said, when you go to Chicago, it's 10 grand.
It's
10 grand a
still
month.
an exorbitant amount. Yeah, I just wanted to add that.
And Dr. Rita, if you'd like to come up, as if you're ready. Is Dr. Rita here? Rita Douglas? Do I have that wrong?
Okay.
Okay. All right.
Do you want me to go ahead or just?
No, Jess, go ahead. Yep.
Okay.
Thank you.
I would have never understood any of this whole pandas situation without like experiencing it. It's devastating. My name is Jess. I've been married to my husband for 19 years. We have 3 kids. I live in Hudsonville. My family was a very like nice, normal, sweet, caring, kind family until 2017. It rocked our world. An 8-year-old at the time, she was suddenly all the symptoms, every single symptom, complete OCD, urinalysis, verbal, physical tics, just not the same child. I'll skip through. You've heard all of this from everyone here, but severely different child. Huge dilated pupils, trashing the house, fighting, aggression, suicide ideation. This is not normal. Washing her hands, avoiding certain parts of the house, objects, people. She seemingly just looked like a kid who was unable to cope, throwing a fit, throwing tantrums. It looked like that to some family. It looked like that to our school. That was definitely not the case. We had no clue what was going on, so we ended up bringing her to her long-standing pediatrician. We were basically dismissed, ended up going to Pine Rest after our child tried to exit a moving car on the freeway. It all compounded. She was a shell of her former self. After I pleaded with the nurses there at Pine Rest, declaring that this just did not make sense, that our former joyful, happy, vibrant child, 8 years old, was totally different. They did some lab work. It showed extremely high strep titers. I was told by this nurse to look into something called pandas. After she completed her 5-day program there, she was on antibiotics, definitely better. We went through a whole host of years of seeing multiple doctors on and off antibiotics. We're told that IVIG was medically necessary. We were denied as well multiple times. Ended up going out of state, paying out of pocket. She has now done 10 IVIG treatments and is doing much, much better. On the flip side, I have another child who didn't have to go through years and years of misdiagnosis, of hundreds of doctors, of hundreds of thousands of dollars. We knew what to do right away. Dr. Youngs helped us, as well as some other physicians. Early onset antibiotics, adenoids and tonsils removed, whole different story. It can be affordable, it can be quick, and it can be treated well. And that's what needs to happen for all of these other kids. It breaks my heart that my child went through all of that, and my entire family for so many years. Like all of these families, we're normal, we're typical families. This is not uncommon, it's not rare. As everyone else has said here, we're pleading for help so that no other families have to go through this. Thanks. Thank you for hearing us all.
Jess, I appreciate it. Jess and I are friends. We go to the same church. I also have a neighbor who I grew up with that has struggled with this with their child. It's how I first heard about it. So, Rita, if you'd like to go ahead, and then if Heather Dickinson wants to get on deck.
Hi, good morning. My name is Rita Douglas. I live in Westland, Michigan, and I'm here today to share my son Jacob's story and advocate for his access to IVIG infusions and share our experiences, which have been critical in treating his pandas and pans. Jacob's struggles began at age 10, right after a strep throat infection. It was like a different person took over his body. He began experiencing tremors where he would shake, and he full arms and legs, and the doctors couldn't tell us what was wrong with him. It took us 8 months and 14 doctors, including pediatricians, neurologists, infectious control types of physicians before we received a diagnosis. During that time, Jacob's symptoms were severe. He became catatonic. He was unresponsive. If you touched him, he wouldn't even acknowledge your presence. His teachers in school were wondering what was going on. And, you know, because Jacob is also autistic, it was blamed on autistic regression, when I knew in my heart of hearts they got it wrong. Jacob's recovery began with antibiotics, and for a short time, he was better. However, strep infections repeated in his teenage years. And each time they're worsening, Jacob's mental and physical health deteriorated. He became aggressive. He began hurting himself. And these were, I believe, because he was in so much daily pain. From the moment he would open his eyes in the morning, his forehead got scrunched, and he would start ripping his hair out at the roots due to pain. He would hurt himself. He knocked his own teeth out because of pain. I cannot imagine, as a human, what he experienced. Through recommendation from his doctors, we turned to IVIG treatments. These Jacob's physicians are Dr. Young's and also Dr. Jules Constantino, pediatric neurology at Henry Ford Hospital, West Bloomfield. IVIG is considered the gold standard for treatment of pandas, and Jacob's situation was severe. After 14 infusions from 2015 to 2019, Jacob experienced remarkable improvements. His pain lessened, his mental clarity improved. He regained his ability to attend school and basically be a functional human being. Without IVIG, none of this would have been possible. he may have even risked institutionalization at that point. Unfortunately, my husband was laid off in 2017, and our insurance provider changed to United Healthcare. It would not cover the IVIG treatments, despite continuation of treatments being deemed medically necessary. We spent years fighting United Healthcare through 6 levels of appeals while Jacob's condition worsened. The stress took a toll on our family, which was unimaginable. My husband, from the prolonged caregiver stress at age 55, suffered his first grand mal seizure. Jacob, at around the same time, suffered his first grand mal seizure from the brain inflammation that was going untreated. Eventually, with the help of an attorney and a lawsuit threat, Medicaid finally covered 2 more infusions in 2019. So today, my message is clear. No family should have to endure such hardship. In addition to the parent stress, there was also substantial stress on siblings living in a household that was in a constant state of crisis. Denying Jacob's treatment was horrific and unconscionable. Why should an insurance company comply and be able to override a doctor's prescribed treatments of patients that they have examined and treated? 13 other states have passed laws to ensure patients can get the treatment their doctors prescribe, and I urge Michigan to do the same. Thank you for your time. Families like ours need your support and access to these life-changing therapies that allow our loved ones to lead healthy, fulfilled lives. And just as an update, Jacob has not needed IVIG since 2019. So for 6 years, he has he's come across viruses, he's come across strep throat and other, he's had COVID, and everything has been able to be handled through Dr. Young's with antibiotics and other therapies.
Thank you.
Thank you.
I interrupted you. Did you want to say one more thing? Rita? I thought I interrupted you.
Oh, it's okay. You can read some of my letters on file, but Dr. Constantino wrote a very impassionate appeal on Jacob's behalf, and just what his experience was. Basically, the word that really sticks out is unconscionable, that this would be denied. I mean, his life would have just been ruined. I don't know how our family would have, been able to live through it. If you picture a worst case scenario, my child is an adult, there were episodes of violence that were really extreme because of these denied medically necessary treatments, where Jacob could, punch his hand through a window or through a wall, or hurt someone or hurt himself because of the tremendous pain that he was in. And all of that could have been treated much earlier. Jacob has now developed other medical problems, such as diabetes, because he was put on long-term steroids. He gained 100 pounds within 6 months, while we were fighting with the insurance company to cover the IVIG, and other medical issues that he's developed because of the delay in treatment.
Thank you.
Thank you.
Yeah, Thank you, Rita. Heather, thank you for being here. Rebecca, if you'd like to get on deck. Go ahead, Heather.
Good morning, afternoon. My name is Heather Dickerson. I'm the mother of 2 daughters, Willa, who is 9, and Adela, who is 7. I consider, after hearing some of these stories, myself somewhat lucky, which doesn't actually make any sense when you're talking pans and pandas. But in the summer of 2021, almost exactly 4 years ago today, my family's world was turned upside down, like you've heard many times today. My 5-year-old Willa, who had been a joyful, healthy, vibrant, full of life little girl, had never missed a day of 2 years of preschool, was preparing for her kindergarten year. I am an English teacher. My husband is a high school administrator. We were all gearing up for the new school year. We went to the Coast Guard Festival in Grand Haven, which was our first post-COVID big outing to celebrate the end of summer and back to school, where Willa got a common stomach virus. Overnight, she became a different person, and when I say overnight, I literally mean overnight. She woke up overwhelmed by severe sensory discomfort, debilitating OCD. She began hallucinating. She could no longer wear clothing. Whew, this is harder than I thought it would be. Refused to sleep in her own bed and began expressing suicidal thoughts at 5. The emotional and physical toll on our family was unimaginable. You hear these stories and they paint a pretty good picture. If you could see videos, it'd paint a better one, but nobody would be able to stomach it in this room. That is the PTSD that everyone in here carries from what we've experienced. 1 week before the start of school, I had to step away from my classroom. My husband took a leave of absence so we could figure out what was going on with our baby. She was no longer able to attend school. She missed her first day of kindergarten and couldn't leave the house. After days of searching for answers as a mother on fire, I discovered that Willa's symptoms matched the diagnosis of PANS pandas. I reached out to Jess Secord, who was a stranger to me in the middle of the night. At the suggestion of a friend, she pointed me in the direction of Dr. Young's, who you've heard from today, who quite literally saved my daughter's life. We put her in the front seat of the car at 5 years old because she couldn't handle her car seat. Drove to Dearborn from Grand Rapids. Willa was put on antibiotics and steroids, and within 48 hours was 80% of her former self. Was able to start attending school, but it wasn't quite enough. Her symptoms persisted, and she continued to miss school, eventually missing over 100 days of kindergarten and first grade, simply because she truly felt like she was going to crawl out of her skin. She couldn't put on clothes. She'd try and try and try, and I want you to picture a 5-year-old on the kitchen floor wanting to go to school and putting on socks to rip them off over and over and over again. Saying, I want to go to school, Mom, but I can't. My socks don't work. And that was our reality. In search of more effective treatment, we consulted with specialists, traveled all over, and doctors recommended IVIG. However, we sought insurance coverage for this treatment and were denied. Despite our doctor's appeals, the insurance company refused to cover this medically necessary treatment, leaving our family to bear the financial burden of Willa's care. We have spent thousands and thousands of dollars out of pocket. I was never able to return to my classroom. We lost our beloved home, and all 4 of us live with a trauma that many can't understand. There is no area of our existence that has been untouched by Willa's diagnosis, and I often wonder what our life would look like had she received IVIG treatment early on in this journey. Sadly, we will never know. Our situation is not unique. There are countless other families in Michigan who are facing the same heart-wrenching challenges. However, they're getting misdiagnosis. I was lucky to find Dr. Young's early on, but there are kids all across our state who all they need is some antibiotics or some steroids or IVIG, and it will literally save their life, but instead they're finding themselves in patient psych wards with their babies. So I stand before you today to ask for the same for all of the children in Michigan. Our children, like Willa, deserve access to the treatment that can restore their health and give them back their childhood. Denying families the medical care they need is not just an injustice, it's an outrage. So please, I urge you to pass legislation that will ensure that children with PANS Pandas receive the medical care they need and deserve. On behalf of my daughter, Willa, and countless others, thank you for your time today.
Thank you very much.
My name is Becky. I'm coming here as a mother of 4.
Erwin, if you want to, forgive me, Erwin Brick, if you want to come up on deck. Are you here? Forgive me for interrupting, Rebecca.
No, I was trying for time. Thank Okay, my name is Becky. I come here as a mother of 4, one with a daughter of pandas, as well as an occupational therapist for almost 20 years. Unfortunately, my story is so similar and vastly different. I won't go into Bella's whole story. She has had symptoms since she was 5 years old. She is now 19, so we've been going through this for 13 years approximately. A lot of similar onsets, OCD, everything like that. What I want to focus on is we had gotten treatment after a year and a half of misdiagnosis, and went from meeting Dr. Young's and her first appointment, Bella throwing things at Dr. Young's head, to going to IVIG, where she was able to completely be close to who she was. She was in the gifted and talented program at school after that, after her treatment change. But what I wanted to focus on is she was one of those patients who had ongoing IVIG that was spread out throughout the time. But there was a 2-year period as a teenager that we lost her teenage year and almost lost her life. When Bella was a teenager, I fought for 2 years and had 6 appeals from Blue Cross Blue Shield for IVIG, even though it had been shown to be successful for her. During that time, Bella had a suicide attempt and overdosed, and was in the hospital, was in intensive care, was an inpatient for almost 2 weeks, then outpatient, and also then developed substance abuse, and there was also a second incident that left her hospitalized. And she dropped out of school, and this was, she's extremely brilliant, talented, loving child, and of course, when she has flare-up, she goes into what a lot of moms have stated here in this room. But my point is, because of that, we almost lost our daughter that 2 years, and now she is receiving them again. Now that she is older, she is getting home infusions, which before, when she was younger, would not have worked because she did have reactions and needed to have supervision in the hospital. And so I just wanted to just add that component, because it is real. It is real when these children have these intrusive thoughts, that it is better to be out of her body, as she had said, than to deal with this. I want to just reflect back to when she was in kindergarten and first had symptoms. She said, "Mommy, you know how they do surgery on people? Can they take my brain out and wash it for me?" And that was a kindergartner saying that, and that has never left me. And then again, in her teenage years, when she almost lost her life, she just said she just doesn't want to be in that body. They don't want to be this. She used to forget what happened, the rage outbreaks, the ripping her clothes off in the middle of the car because she didn't want it touching her. And then she would just, when we were all in the aftermath of these episodes, would wonder why she didn't remember any of it. So they don't want to be this. And I guess I just wanted to add that component. Thank you very much.
Sarah Lascata, Scott, if you'd like to come up.
As you can see, Paige is not at school. She's here with me today because she cannot attend school. Good afternoon, Chair and members of the committee. My name is Erin Brick, and I live in Berkeley, and I'm here as a mom to speak on behalf of my 9-year-old Paige. Paige enjoyed dance, ninja skills, swimming, Girl Scouts, play dates, and recess. We had gotten her assessed for boredom in the classroom, and she was found to be twice exceptional, with particularly high scores in art and math. At the age of 7, after a routine camping trip and a simple fever, Paige's life changed overnight. She became gripped by paranoia and severe anxiety. She couldn't leave the house. She couldn't go to school. She couldn't control her emotions. It was terrifying for us to watch. Her pediatrician couldn't give us any answers, and over the following months, you okay?
Yeah.
Okay. Over the following months, we saw specialists, neurologists, rheumatologists, immunologists. We saw them all. And doctors would say, we can see that there's neurological decline, but we don't treat this. It took 6 months of appointments, emotional and financial strain before she was finally diagnosed with PANS and PANDAS. She has both. This diagnosis came by going out of network with no insurance coverage. But the diagnosis was just the beginning for us. Despite finally having a name for this condition, no doctor who would accept our insurance will treat her. They either aren't familiar with PANS and PANDAS or have said that the treatments aren't covered, so therefore they will not take the risk. In the meantime, Paige has missed almost her entire second grade year. We had to rely on homeschooling, private schooling, and tutors for third grade and now fourth. None of these are covered under insurance. We found only one doctor willing to treat her so far, and it's all out of pocket, and it's been more than $10,000, and it's still ongoing. Paige's latest neuropsychological report has shown, I don't want her to hear this, that she has significant decline in mathematics skills, so bad that it was diagnosed as impaired. Where she was once in the 86th percentile, she's now in the 5th. She's lost fine motor, executive function, visual memory, short-term memory skills, among many more, and PANS and PANDAS explains this all. And treatment can reverse these neurological effects. She needs IVIG, and we can't get it for her. Let me be clear, without clear insurance coverage, children like Paige are denied care, and families are either left to pay massive bills or watch our children deteriorate. It's not right, and it's not sustainable. PANS and PANDAS has robbed her of her childhood for the last 2 years. It leaves us desperate and financially drained. Doctors won't treat it because insurers won't cover it. That's why I'm asking you today to support legislation that guarantees insurance coverage for this condition. Our kids deserve a chance to heal. They deserve access to care. We as parents deserve a system that doesn't abandon us when we need it the most. And thank you for your time and your consideration for the future of people like Paige.
There are a few others that would like to testify, but I think we're going to end with Sarah. I just want to say thank you for coming. I'll leave your names at the end.
Hi, good afternoon. My name's Sarah Lescott. I'm from Kimball, Michigan. It's over by Port Huron. My son, who's 15, Marcus, he went to use the bathroom. He's here with me today. He was diagnosed with PANS and PANDAS, so just to be clear, some kids could have one, the other, or both, and he does have both. The autoimmune condition and PANS, which could be from Lyme, Bartonella, Babesia. We think it's really hard to pinpoint if it was from COVID that caused the autoimmune reaction or the tick bite. We ended up moving from in-town Port Huron out to Kimball, which is a little bit more rural. He'd hang out with the neighborhood boys in the woods. Somehow got bit by a tick at some point. There's studies done that you can actually contract Lyme, Bartonella from mosquitoes, from ticks. It could be passed sexually from mother to child. These are studies done on a family of this. So it is hard to tell, but he has brought a tick home before, so that's how I know that's where that had been contracted. This all kind of started when he was in 6th grade. He's going into 10th now. He really was kind of starting with the OCD, with the tics, the rages at school, constant calls from teachers, emails, constant anxiety from me, crying, not knowing what's going to pop up from day to day. Wanted to pull him, wasn't really sure what was going on. I reached out to an ADHD group asking, because he was diagnosed with ADHD, saying, this isn't normal, is it? We had started testing with a neurologist because they were saying he had absent seizures. We're like, okay, this is strange. They put him on different medications. Depakote, he flipped a table at the school 2 days later. That was pretty terrifying. We never had experienced anything like this beforehand. So to experience that, you're just like searching for answers. Weeks go by, we're in Children's Hospital in Detroit because we're like, what is going on? He's coming home, having meltdowns, barely being able to speak on the ground. I have 2 other, at that time I was pregnant actually and had my daughter. I took him there. They said, let's start him on Lamigdal, which I heard another parent, mention. Tried that for 6 weeks. See no results. It got to the point where we started having an in-home counselor come, a respite worker, because his skills then started recessing. He couldn't write without crying. I used to go into class in elementary school. They were doing long division. I kept in constant contact his whole school career. Wasn't able to do that anymore. Eventually was expelled in December of 2021, months after all of this started. Eventually reaching out to the different groups, someone recommended a doctor in Ann Arbor. So at this point, I'm not working, I'm pregnant. My fiance did work. I had credit cards, so I started racking up bills, which 4 years later, I am still paying off. Thankfully, we ended up they did the Lyme testing. That's how we figured all that out. Organic acid testing. We went to the Imagine Center in Detroit, trying to, allergy testing. IVIG isn't a first round. That's not the first thing you go to. We are now at that point 4 years later. So we are just in the process. So my story is a little bit different, that we just started with Dr. Constantinu just last month. After originally calling in January, we've seen Dr. Young's. My son gets a flare about every 6 months. We get the antibiotics. It kind of seems to help it. I've called the crisis line. We've had the police multiple times. So he's seen multiple psychiatrists. So this isn't anything, that can be healed with a pill, with a simple pill. That's just putting a Band-Aid. And it's to the point where some parents may have to do that in the meantime because it gets rough. He's kicked out a window. We've had holes kicked in our wall. And like was mentioned, the different, his strep titers are always high. They could do a swab on his throat. It's negative because it's hiding in the gut. It can hide in other parts of the body. So that's the really hard part to detect. And that's what scares me with some families that might not have that knowledge. Their child's acting out, they can't figure out the core of this. But thankfully, a lot of us might have the time and resources to do that, or our children might not be here because we have gone through the suicidal effects multiple times. And I know it does affect boys more so than girls, just from what I've seen. But I just sometimes feel a little bit envy reading these Facebook groups of these other parents who are able to get that help. And I do feel scared for some of the doctors in our state because this is a controversial illness and they could face repercussions. Our original pediatrician, in the beginning of it, said, can we have labs done? Never was done. She said, I don't feel safe doing that. So then switched pediatricians, and she actually used to work in Dearborn at one point. So that was kind of a weird connection, and she will consult with Dr. Young's. Our latest testing was mycoplasma. Those titers were high. That can also cause the inflammation. So it's just a lot of these co-occurring disorders. If you look on Kindle, there's multiple books. So I'm just kind of trying to inform myself on all these different treatments. And so we're just in the process of this, trying to do the IVIG, and I just, all this suffering that these families have gone through, I just, really wish we didn't have to, and I just really, for the other families, would hope they wouldn't have to. So I'm just asking if you guys just consider all of our stories and just look into it. I appreciate your time.
Thank you.
Thank you.
Bruce, do you want like 2 minutes?
I'll only take 1 minute. Representative Meerman, thank you so much for giving us an opportunity to shine a light on this problem. We know that you care about children. You've demonstrated that over and over again, and we want to follow up with you and see what we can do about the problem that we have highlighted today. Thank you very much, and we will give you a hand right now.
I'm just going to end with saying I'm grateful that you're here. I'm grateful that you found the time to come here. I'm sure there are many more who can't even leave their house today to come and speak. And your stories grip my heart. And I guess we'll see where we go. Again, just thank you. I got a few cards to read in, and then we'll finish. So, Rita Youssef Slaba wants to speak. I'm sorry we didn't get to you. Carmen Cox, same thing, wishing to speak. I'm sorry we didn't get to you. Thomas Calio does not wish to speak in support. George Andonian does not wish to speak in support. Matthew Paddock does not wish to speak. Marcus Nyes does not wish to speak. And Olivia Andonon does not wish to speak. So, again, your presence is noted. This is the first time this committee has had an overflow room. This is the first time this committee, frankly, has filled either side of that back there. So, obviously, there is a need. I need to excuse him. Okay. There being no further business before the committee will stand adjourned. Sorry.